before these things start. We've all been working together for quite some time, so it's
Yeah,
Boyd has it
Alicia
pretty
said that she
organized.
thought maybe Jennifer wasn't going to show up, so she was worried that people were getting tired of her. So I made sure to
Yeah,
say that
tired
we
of my
like her
face.
hair, we like her talk, we like her internet most of the time, we like her
Yeah, we like my
stories.
lipstick, new
She always
lipsticks.
changes it up.
Yeah.
Mhm.
Yep.
Well, yeah. Uh, and I now, if people ask me what I do for a living, I usually tell them I talk for a living.
Right.
Not all coders can say that now, can they? Yeah, coders and
No,
billers.
no.
What do? I talk for a living. Yeah. We have a great night for you guys.
Mhm.
It's been a while since we did a CCO live or a live with CCO, and but we've done 20. We've done 26. We're into 27. This is really casual, everyone. We want this to be a time where you can ask questions. We'll be keeping an eye on what you ask, and just kind of an open forum, I guess. So we'll give you a heads up of what we've been thinking of and some information we want to give you, but we really appreciate it when you also ask us questions or give us some insight on what works for you. That being said, secret resources to make your job easier. Why are you making that face, Jennifer?
I hit a wrong button, so I was like, "Uh-oh."
I could just see that out of the corner of my eye because
I couldn't
we
figure
were
out where
talking
it
about
went
coming
to.
screen. Yeah, and I was like, wait, Jennifer made this face she'd never made before, like, oh no, something's not right. It's like,
Sorry.
you don't want to do that when Boyd leaves. It's like, no,
Don't
don't
forget I'm
break
on
it.
camera.
Yeah, that's right. That's right. So, secret resources. We've done a couple of videos already. We've got them out there free for you to see on our YouTube channel, Medical Coding Cert. They were really well done. The we've done several, but two that stand out in my mind are ones that Chandra did. She did one in 2016 and she did one in 2017. The They're easy to find. You can go to the CCO or medical coding cert on YouTube, and maybe you're joining us on YouTube. If we're now live streaming on YouTube, Facebook, and LinkedIn, but I put the resource link at the end of the slide deck. So if you're part of our CCO club, you'll have access to that, and you can pull up that video. If you're not in the club and you have to do it the long way, where you go to YouTube and then type in medical coding cert, and then in the little looking glass, just type in CMS, and you'll be able to find the video that Chandra did. And I think the other one was resources, but the year on those was 2016, 2017. A few things have changed, but we're going to show you two tips for being able to resource any site, or well, CMS, but this first one is any site. And we've talked about this several times. Laureen showed us how to do this a long time ago, but we've never actually put it on the screen. We've always like brought up a website and typed it in to show you. So this time I actually typed it out for you. And this allows you to look at any website. I would go to Google, right? And then in Google, you can type in the word site colon the site that you want to search, like find a code. So if you know that website, findacode.com, and let's say you want to know the 2020 ICD changes or updates, then you just write that after that. The key is when you write site colon and the website, there's no space. Okay. Now let's say you put in what you want, 2020 ICD 10, then you can put in site colon and the website. So you can either put it at the end or you can put it at the beginning, but the key is that you put site colon and then the website you want to search, because if you go into Google and you put in 2020 ICD, you're going to get 1,000.
Mhm.
Okay, 1,000 hits, and not all of those are going to be even in the realm of what you're looking for. You're going to
You're
have
going to get
YouTube stuff.
journal articles. You're going to
Yeah.
get people
People's
advertising their
opinions.
services. You're going to get, yeah, just about anything. I use this all the time to refine billing. So in billing, when you've got these shoulder surgeries, 29827, what does Aetna say about 29827? So I do CPT 29827 site:/Aetna.com.
Yep.
Brings me everything on every Aetna site about 29827 CPT. So it is quick and easy way to find going, why didn't Aetna pay for this? Let me see if they have a guideline for it. And then, oh, yep, they do. So I already know they're not going to pay for it. So it very easy on the billing side to find anything you want from a specific website that you're looking for.
That's another secret resource tip, you guys. If you want to know how to code certain things as far as guidelines specific, all of these payers usually have training that they've given their providers, okay, or users, specifics, and they will be up to date most of the time. Or at least the year will do that. They even have free share slide decks and things, but they'll explain it and they'll give you examples. And a lot of times it's a provider explaining how they're to document and code a specific procedure or diagnosis. And the reason they're doing that is so that communication between the payer and the provider is clear, so they offer that training. That's some of the best. I get stuff from Blue Cross Blue Shield, Aetna, Cigna, Humana. Humana's really good. Kaiser Permanente is really good. You can get things from them. They do a lot of training, but some of the best sites. There's a few other things that you should know about that. Let's say orthopedics, you wanted something specific about a procedure. Let's say it's an ORIF. Okay. Well, you could go to the and I don't know if this exists, but the American Academy of Orthopedic Surgeons.
AAOS,
Is that what it is?
AAOS.org. Yeah.
Yeah, there you go.
Yep.
And they've got that for every specialty that's out there in
And they
providers.
usually
They have
have
an organization.
across the top of their page of all their providers, home, store, that you can buy things, whatever classes, they usually have a coders section or billing or a blog that mentions coders or billing. So yeah, I've used that a couple times. I'll go, well, because I'm doing a lot of different auditing for different specialties right now. So I'm like, well, what does that specialty say about this procedure?
Right.
Are they billing it right? And I'll go there and there's a billing blog and they'll say, because you're not the only person that's had that question. So everybody has that question. Now, unfortunately, Alicia used a good example. Okay, so AAOS, American Academy of Orthopedic Surgeons. So they believe that a shoulder is divided into 3 compartments. Medicare believes a shoulder is 1 compartment.
I was going to say 2, but yeah, okay.
Yeah. So when come to billing, so they, but the Orthopedic Society is the one pushing to say, okay, guys, no, this is why, and they try and give their education and their reasoning for new codes and things like that, or the way things are billed, and that should be changed. But then, and we'll show you a site here soon how to get to how Medicare says some of those things. So specifically Medicare, since United Healthcare, of course, follows suit. Medicare and Humana, some of the other carriers will follow suit with Medicare. So.
And that is another reason I like going directly to these associations or organizations for a specialty, because they are talking to the provider and they are telling you, what's the best way to document this, right? And that they're training them, not knowing that in turn they're training us as well, because we're that liaison. We're the one that translates what they've documented into the code, the proper code. And it's keywords that make a difference between a type of procedures that's done versus in the shoulder for, ultimately, this isn't the way it's done, but ultimately, we want our providers to document the way that the code is written. That would be great.
Yeah.
And some do. There's a lot of, let's see, I think it was one of the it was a health con. And then when we were up in Rochester, Minnesota, one of the local chapter meetings, we had a plastic surgeon come in because the president of the chapter actually worked for that plastic surgeon. And they had a really good relationship. He had like 3 coders for him, and he came and did a guest lecture for us. And he said, if I wanted to make sure I was getting paid for the work that I did, then I had better learn how the payers, understand the codes. He said, so therefore, I went out and learned how to code. And he said, I will, look at the code or talk to my coders and say, I think this is what I'm doing. Is that the right code? And they'll say, yes. And he said, I make sure I document exactly what that code states so that we're on the same page. And all the women just kind of went, oh, please still my heart. If every provider did that, wouldn't that be wonderful? And so, that's another reason why he was being a guest speaker for us, because he said, we should appreciate what you do, just like we appreciate what they do. But you're literally on the same page. And I've had other providers do that, tell us that they did that, and it made their life easier for them to, just get the basic coding knowledge. You don't have to get the credential if you don't want. But man, if you ever want to, you're thinking you want to work for a provider, and if they've got a coding credential behind their name, man, that's who I want to work for.
Well, I was telling Alicia before we started that I'm actually taking a boot camp right now with NAMIS. And I don't know if you remember Rick being on, Rick Salomon. That's one of the organizations he mentioned was NAMIS, their medical auditing society. And so this is specifically for E&M orthopedic credential. And there's actually an orthopedic surgeon who's also in this, because it's a live online thing, so we can ask questions of the presenter. And so he asks quite a few questions going, wait a minute, I'm supposed to say it like that? Okay, so as long as I document it that way, because then he gives his reasoning behind it, which we all know that's what the doctors do. They have more reasoning behind what they actually write. So it's interesting. He's like, okay, now it makes sense, because don't I get paid for that already? And we're like, no. And he's like, oh, okay, so now I got it. So it's kind of interesting when the doctors do finally sit down and try and learn
Have
some
that
of this
aha moment.
themselves. Yeah.
One of the things that I would love to be a part of, and I know last year the president of the Austin chapter, she was at one of the conferences, or it was the year before. I don't know, the years run together. And Austin, Texas has a relatively new medical school, and she, like me, had said, we got to get this training in there for the
Yes.
med students. If they had this training, everybody would be much happier. They're being forced to code anyway. It looks like we had somebody from LinkedIn. Alston said, I just finished my CPC program and I'm now studying for my certification. Fabulous. That is great. We're excited for you. Let us know. Go out to the CCO club. Let us know how you do and what you're doing to help study, what resources you're using. We have a lot of resources that we give out free to people. You don't, even if you're not a member of our club or you're not taking your course through us, testing tips and stuff. Make sure, though, Austin, that you're taking as many practice exams as you can get your hands on. We have free ones at CCO, the AAPC. We have paid ones. AAPC has paid ones, and there's some other organizations.
Yeah.
Let's
that
see,
offer it for a fairly decent price, but then they also provide all the rationale and stuff, which is good. I mean, because those are all, that's what you'd want to not just somebody who tells you the answer C. You want to know why the answer C. So
That's right. That's right.
which
Patty
suits.
Pratt says, I have a CPCA and I'm staying up on my CEUs. Brilliant. Yep, you got to do that. A lot of free CEUs out there, but haven't been hired yet. I have no real experience. Understandable. And feel free to check out CCO's internship program. You can go to the cco.us and then go up to the top, and then it says contact. And there's a big long list, and we have an internship program you might be interested in. However,
I did like how Jerice said that she needs to start attending the monthly meetings.
yes,
I tell you, networking.
that's how you're going. That's going to get you a job faster than
That
anything, Patty.
and they're just. I'm sorry. I'm going to write some articles for the AAPC Monthly about this because they really are fun. I mean, how often can you sit with a group of people who know exactly what you're talking about? So when you go home and you try and talk to your family about your job, they're like, "Oh yeah, I don't understand what you're talking about." Or, "Aren't you a doctor, Mom? I mean, you work in a doctor's office." So
I know.
it's to have that little set of people that know the stress of your job, that know the demands, that understand the continuing education, that understand how important it is to find a job, to network with those people. It really is. I'm sorry. I cannot talk it up enough.
It's a community, right?
Yeah.
And it's a very positive. Now there's people out there that are Debbie Downers, don't get me wrong. There are in every group, However, for the most part, very seldom have I ever gone to a chapter meeting or any type of side organization type thing that, conference or whatever that have been associated to coders and billing and the what we do, which is beyond coding and billing compliance stuff. They are friendly. They are. I know on LinkedIn, I have people that check with me on LinkedIn all the time and say, I'm struggling with ABC, or, do you know somebody that knows this or whatever? Well, just before we got started, Jennifer was asking a question about anesthesia, and that's not her specialty. That's not my specialty. But we hear things, he's like, no. And so she asked a question. I said, no, I don't think that's the way it's done. I'm pretty sure. No, and I said, but do you want me to go ask somebody I know? And I was able to type it in to Messenger, and before we got on, within minutes, I had somebody sending me back a message, and so it takes time to sometimes build up that networking, but you're never alone if you connect with other people. There's no competition on jobs. It's predominantly women, don't get me wrong, but we've all been there, and I think we're pretty friendly a lot.
Out of the 15 people that are doing this boot camp, 3 of them are men. One's a physician, and then 2 other male coders. So, and then the rest, and of course we're specific to orthopedics as well, because that's what this credential is for. But yeah, I mean, it's definitely growing. I don't know how many men. I know quite a few men.
Every year that I went to HealthCon or go to the meetings, or if I asked to get to speak, I'm going to go up to Dallas
She
again.
does.
Here, it's going to be there's more men every time I go to a big chapter
Well,
meeting.
she usually walks up to them
I
and
usually call them
purposely
out.
sits with them and tries to. And okay, how did you get into this?
Was
How?
that true
What?
about
Why?
nurses too? Did it was predominantly a female thing and then gradually it became male?
Yeah.
Yeah.
Well, think about it. When they had you stop wearing the hats, I think men were a little more excited about getting into the field. I don't know. I'm just kidding.
Were there male nurses that wore those hats? I don't remember that.
No.
I don't think so.
And then the women would get mad because the men weren't required. But honestly, when they gave up the hats, I no longer wanted to be a nurse. So give me that. I want the
Because
white.
Alicia's a hat person.
Oh yeah, I want the uniform. I want the RNs to wear white stockings. And if you're not an RN, you don't get to wear white stockings, the white shoes, and the hat. I have dreams about those hats. I tell you, they should bring them back. But if all the nurses like, no, I liked you until you made that statement. Whitney says, good luck to you, Jennifer. Hey, are you going to HealthCon? I think you're already signed up, ready to go, aren't you, or not?
No.
Yeah, I don't know if I'm going to make it this year.
Well, I
I
was
wasn't
supposed to
asked to
speak.
speak,
I
and
was I
she
was
was
supposed to
supposed to.
speak, and then that didn't happen, and then yeah, so I'm kind of been on the
Oh,
fence ever since. I want to, but now it's a financial thing. Because when you speak,
yeah,
you don't have to pay for it.
for the
So, I mean, you
conference.
you don't pay for the conference. You still have to pay for a hotel and stuff. But
Right.
yeah, so I was like,
Yeah, the
well,
conference. And that's a
now
thousand
I'm
bucks. Uh, and
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 I don't have a
so
job right now, so
when they between the regionals too, I like going to those too because
Mhm.
they are a little bit more intimate. HealthCon is great, it's fun and everything, but we're
It's a lot of
talking
fun. Yeah.
over 10,000 people, over
Mhm.
10,000, probably more than that. Uh,
And
so
really good presentations, though. I mean, those workshops,
absolutely great.
those
Yeah,
are the
yeah.
things you want to hear, though. Those are,
Mhm.
yeah.
And so those are fabulous. And then if you can't make it to HealthCon, and they only have it in two places. They either have it at Disney or they have it in Vegas every other year. The venue's great, easy to fly in and out of, etc. and stuff. The food's excellent, but you always have the regionals. And what's nice about those, like I said, they're a little bit smaller, a little bit more intimate, but they're still pretty big. Uh, but you, they break them up. So
Mhm.
last year was Seattle and New York. The year before that, it
Mhm.
was St. Louis and California, and yeah, Anaheim. And
And
so
DC, yeah,
DC, we went to DC.
yeah.
So, you know, and those regionals don't cost as much either, as far
Mhm.
as attending. But and great, still get to meet great people and stuff. So would encourage you to do that. Let's see, Gercy Jones, have they? Let's see, they have a lot of jobs on AAPC and CCO job postings. Yes, thank you. You're right. And now for CCO on our job posting area, we only post remote positions, just because we
We're
just
remote.
kind of said that. Yeah, yeah, we're all
Yeah.
uh, however, I know the AAPC does that too, or
Mhm.
I think they do other jobs, but really LinkedIn is a fabulous place. I think Coder Direct was the latest one that I've been paying attention to, and I reposted some of their ones. That's all they do. I don't think I'm sure they're recruiters of some type, but they have a lot of job postings, um, and a lot, and I think they tend to find people that are newer coders. So you might want to look into that as well.
There's, especially when you start to see periodically, like on AAPC, you'll see them post, or even on Indeed. I see a lot on Indeed.
Yeah.
Because Indeed, they send me under remote, they send me under instructor, you can
Mm.
ask for any group, any wording, medical coding, medical billing, whatever you want to be. So I get multiple ones sent to me daily of new jobs postings on
Hmm.
Indeed. But when you notice a company quite often on there, like McKesson, or
Yeah.
I now have them bookmarked. Some of these companies that once a week I'll pull it up and go, oh, they got anything new coming in there.
Hmm.
So, just some of the companies too, you can go straight to
Yeah.
and see what they offer. Remember
It's not the
other
same
things
as
like
it was 10
insurance
years ago.
companies,
Yeah.
Humana, Cigna, they hire as well. They hire coders, risk adjusters, billers,
Karen,
a lot of things
nope,
like
it's
that.
Sarah Hand said, same here, got my CPCA and still looking for a job, currently taking Practicode from the APC, which I've heard some, we won't talk about that, but because we want to stay positive. But uh, just like Jennifer was saying, whenever I see that type of comment, then I want to say, hey, think outside the box.
Hmm.
Don't just think hospital clinic, hospital clinic. No, there are so many more options for you. What are some other things? Okay, you got your insurance companies.
It's really funny. I was cleaning my room the other day because as things sit on my desk and I need my desk for something, then they get a pile on the floor. And then I
Yes.
add more onto the pile on the floor. So I was
I
cleaning my
know.
room the other day and I came across something that I had printed actually for one of our chapters last year. I know I'm not going to be able to pull it up right now because it's somewhere over there on the floor. Um, but it was, yeah, that thinking outside of the box. And
Mhm.
and all I did was go to some of these searches, some of these job sites, and pull out some of those random ones that people don't think about.
Mhm.
You got your insurance fraud investigators. You got I can't even think what they were, but just different types of job titles that people probably skip over. And
Mhm.
they're looking for coders too. I really wish I could think of what it was.
Well,
Um, yeah.
put it when you find it. We'll put it
Mm,
in the CCO club,
Yeah.
and then that way everybody can share that. But before in the past, we used to say, "Well, work in the front office because you can learn billing
Mhm.
and stuff." But I was kind of, I wouldn't say it was counseling, but talking to somebody and kind of letting them pick my brain and kind of making them feel better. It was actually on LinkedIn, and they had private messaged me, and I I got a feeling that, hey, this person might be better suited for billing. It's like, and
Oh,
then
yes, yes, yes.
she had said, do you think that I should look at that instead of coding? And I was like, well, there's several reasons why that's a good thing, because first of all, you hear Jennifer and I talk about this all the time. If you're a coder and you know billing, you're a better coder. If you're a biller and you know coding, you're a better biller. You just are. And it makes you a double threat. It makes you more hireable. But
Uh-huh.
billers actually make a little bit more money than coders. They can work remote, but they tend to have more of a turnaround. And I don't know why they have a higher turnaround. In my opinion, it's
Uh,
because it's not my favorite thing to do, and it just is constantly rejection, rejection,
it,
rejection, but that's not the way somebody who loves it, like
yeah,
Jennifer explains it. She's like, "No, you get there and you investigate it, and,
you gotta
and
win that fight, man.
yeah, and
If
she's
you're
like,
not set
it's
out to win that
challenged
fight,
and stuff." Right.
yeah.
And so it's almost like two different mentalities. Now, can I do it? Yes. Do I, when you get in there and you're doing it, do you like it? Yeah, I do. I've done it and I enjoyed it when I did it per se. But then when I was doing others, like, no, I like this better if I had to choose.
Mhm.
But um, but still, there are several types of billing type jobs. Another
Mhm.
little tip, I did a side contract for the hospital that I used to work at like 20 years ago. Actually, it's like 30 years ago now that I think about it. Well, I don't think it was 20. But financial services is usually the title. You're in the financial services department. Didn't used to be like that. And so that may be a key word you need to look at for some
Mhm.
of these facilities and organizations and stuff, financial services, to help you refine your search.
Well, real quickly, we had on Facebook, somebody mentioned working for lawyers. Yes, because when they take on medical auditing, um, people coming to them uh,
Hmm.
for possibly malpractice reasons or other things like that, they do need certified coders to review their records.
Hmm.
Equian is a claim auditor for work comp, so that's a
Hmm.
good one. And then we had a request to continue with our presentation on resources. So
Oh, sorry.
it,
Uh,
it,
we can sidetrack. Oh, now, real quick though,
exactly.
another
Yep.
thing to think about based on what she just said, that not just lawyers, but like McKesson, uh, EHR companies, they
Mm-hmm.
need coders, especially if IT. So the next thing we were going to bring to your aware was a Boyd. Did Boyd send you a message? Because I got it covered up. I can't see what he was saying. Uh,
I don't know.
how to find what you're looking for at CMS.gov. Now, I look at CMS.gov for a different reason that Jennifer does, because the type of jobs that we do are different. However, she gave me the link to two areas that she frequents, and I'm going to pull one over. Hold on just a second. I'm trying to pull it over, but
So
it's giving me.
definitely actually on both sides. So
Oh,
CMS.gov is a wonderful site for billing from my end, because you're going to find out what the rules were. But for coding, it's also very helpful, because those same things that a biller is going to look for is what the coder needs to look for. So one big thing is I used to do podiatry. So there's a lot of rules for podiatry. So if you have you can only have the corns and calluses removed every 61 days, and only for certain diagnoses, like if somebody has diabetes or something. So I mean, that information is very helpful to coders, because they need to know what services, what's going to be required for those services to meet the medical necessity. And we don't want to say to get paid. We want to know medical necessity, because on the billing end, do you have to have that patient sign a waiver? If it's only been 50 days, that patient's going to be responsible, or they should come back in another 11 days. So, you know, on both ends, it's very important. Now, this one that she brought up, this is, everybody knows the NCCI edits, right? This is how we code. What codes can go together? What, okay, I'm brain freeze here.
What
Where are
codes
modifiers?
can't go together? They're bundled
What
in.
can go together? What can't? What needs modifiers? So we know to go look at the NCCI tables, right?
We
But
showed you how to do that.
yeah, so if Alicia were to scroll down, and towards the bottom of the page, you'll see some more links that are down at the bottom. And the very first one, so those downloads, the NCCI policy manual, this is a zip file. So this is multiple specialties. And what they do is they break it into each section of the CPT manual. So you'll have your E&Ms, you'll have 10,000, 20,000, 30,000, okay? So in your specialty or in your area, it's really good to look here, and they update this every year. So I'm in orthopedics, right? If you look at CPT, you can bill when somebody fractures their foot and they fracture each metatarsal in their foot, you can bill 5, right? They broke them all, right? It's each. It's not plural with an S or anything. However, when you send that to Medicare, what's Medicare's reasoning? You put one cast on the patient's foot for the entire foot. So you're billing one fracture. So that's all described in here, all those shoulder surgeries, that if anybody does orthopedic shoulder surgeries, so you'd pull up your 20,000 section there of CPT, and they update it every year. So you'd see in red will be all the new writing when it comes up. You'll be able to see anything new added this year, discussions about having an office visit with a procedure, how many MUEs. This is very helpful. And a lot of people don't even know that this is out there.
Yeah.
So because they go, well, CPT told me this, and then I looked up the NCCI edit and it says this. But these are their rules. These are what they follow. So a lot of people don't realize that these are out there. So if you're wondering why something's not getting paid, if you're wondering how to bill it, is a very good place to look on CMS. So you can look up any of the specialties out there.
That's great.
They're
So
all in here.
when you
So.
have a document that's okay, this one's 17 pages. Another little tip, guys, if you'll just hit Control F. Now, of course, this has a search in it, but on any page that you're on, anywhere, if you hit Control F, it'll bring up a little box, and then you can type in a specific code or word, and it's going to, obviously my computer is stalling out, but of course, if you've got Adobe or something, but let's say it wasn't.
And even right here on that where you were, it says 59 or the XU, because remember they want to start using X codes now more.
So let's just put in XU, and then it's Control F XU,
and then it will tell us every place that XU is mentioned. So if there's something specific you're trying to look for, it's going to find them all in that in that PDF, in that anywhere it's mentioned. So you'll be able to go, okay, is that code supposed to have an XU? Things like when the codes change for the next year, like these 60,000 pain management injection codes changed this year. What's their new ruling? What can I do with them? Do I have to use an XU or do I use a 59 because they did multiple? So, it's a lot of people don't realize this is there. I actually didn't know this was there for
And
years,
another
and an
thing
ortho
that
specialist told me about it.
will help you is here these usually when you have stuff like this, especially from CMS, when we told you before, when you look at like Cigna, Aetna, and all them, Humana, they will have examples. Because it's one thing for them to tell you, this is how you code this and this thing. Give me an example. Now that's the way I learned. It's like, no, I got to see how you would do it
Oh
actually.
yeah.
And so you could literally go in and type example in a thing and it'll take you straight to the examples. So here we've got epidural blocks, and there's an example of how they're saying report, these codes, uh,
And then it's even
going
telling
forward.
you the anesthesia code on there too,
Yeah,
which,
yeah.
yeah, because it's even though you're
They
not in
give
the
you
anesthesia
form.
section, it's still effective. Yeah.
Yeah, daily manage of epidural,
It's for,
because this is practical applications like you would be doing real world, whereas all this stuff that they're telling you up here, that's not. They're just stating the facts. But the examples are, I find them very helpful. So hopefully that'll be, as you said,
if
it's one
you've
of
ever
those
wanted to know
secret
what the X
searches.
modifiers are and how to use them, CMS has an entire brochure on the download of the 59 and X modifiers, and it gives you specific examples of when you're going to use an XU versus an XE versus an XS, and
Right.
it
And
lays them out really nicely.
what I think it will be helpful for you is when you have something like that, that's easy to fold up, take with you, and you can just you can give them to everybody in the office, right? You can take that and put that on your desk or laminate it or whatever you do, put it in one of those sleeves and put it up on your wall. If you guys could see my wall with all of my notes and everything, and I think one time I showed you my list of cards. These are notes that I've taken during the time, when I'm working and stuff. I'm a color coding person, but ultimately what I do is I'm jotting myself down notes, and then I later go and put that somewhere where, I may not need it today, but next week I can just look up, and see that, and that helps you. So that would be a document. The other one that we want to talk about, the internet only manuals, the IOMs.
Yes.
This is really
I
helpful, guys.
still learn information from the internet only manuals. So this is under cms.gov. You go under manuals and it brings you, and then you click on internet only
Right
manuals.
here.
So these are all of the manuals that they have available. Now, most of the time we talk about 100-04, which is our claims processing manual. So everything in there, if you want to know if a nurse practitioner can provide a particular service, what can a physical therapist do, what radiology things. I mean, I still read. I mean, I've read almost every chapter of this internet only manual, and there's a lot of them. There's like 23 or something like that. But still find more information. Or when I'm getting a new auditing project. So I do contract auditing
38.
work.
There's
Yeah,
38 chapters.
I knew there was a lot.
Yeah.
Some of them are the crosswalks though, so
Yeah.
those are different. But I'm in a new section that I'm not really familiar with. For a long time, I did behavioral health. Well, I'm not familiar with behavioral health, so I think I pulled this up daily. Okay, what does Medicare say about what a behavioral, who's a counselor? Can you
I can
do
find that.
interns? Can you do, who's who do they count as a provider? So they have part A, part B, skilled nursing, home health, hospice,
Sniff.
providers, I mean, ambulatory surgical centers, everything. So any section that's being billed, and this is all your billing, they have laboratory, they have, anything that you're billing has a manual for it. And again,
Mhm.
that Control F is really good because these manuals are 130 pages or something like that
Yeah.
each. So your
Yeah.
Control F goes nurse
I had a
practitioner.
sniff
That's what I want
question.
to look specifically for is
Yeah, I had a sniff question come in from somebody the other day. We were looking at, and I had to go ask uh, somebody else because it wasn't what I thought. And they said that, they had two people, two coders had two different opinions on how to code something. Was it follow-up care or was it something else? And because they had been moved from inpatient to sniff. Well, were they discharged from inpatient and put into sniff, or were they just using sniff as a, you're not being discharged to the yet, you were just being moved over to sniff before we discharge you, and that all changes the way you code
they
for
will
billing.
explain all of that in here,
Hmm.
and they
So
give
when I saw that
examples.
sniff, I was like,
And
man,
they
I should have gone in here and looked.
we had a question last year. Somebody was like, well, it's a swing bed, but we only have this many. So does that count? You know what? I went
Yeah.
straight here and I was able to answer that question. I pulled up swing bed and it brought me right where I needed to go. And it defined how many swing beds you need in that facility and who
Hmm.
meets what criteria. And,
Hmm.
and I know this is Medicare, but
Well,
it, it,
Medicare does, everybody else usually follows. So.
it is a good resource. It's a good
Mhm.
jumping off point because then you can at least get the basic of your information and then go,
Mhm.
okay, does Aetna say anything about this? Do they have the same rules? So it's a good
Mhm.
place to pull information. Some of the other manuals, and it's funny because you're reading here and then it will reference, see this manual. Well, okay, but then it gives you the link right there. So you click on it and you go straight to the members manual and it describes some of the members information. So there's a lot of appeals. um, do you know what the Medicare appeal process is? There's
Mhm.
multiple levels and they all have deadlines and time, and so it it breaks down pretty much anything you need to
Everything.
know. And
Yeah.
I say I wish every insurance carrier had a site like this
Mhm.
because sometimes you go to Cigna can be pretty vague. They
Mhm.
may have some great information for the members, but the providers don't. So we have to kind of extrapolate what they tell the members and say, okay, I guess that means as a provider, I can bill that because if the member meets this
Right.
criteria, then
Right.
I guess we can meet that criteria. But this will tell you exactly what that criteria is.
Mhm. And it isn't, not only does it help you in your daily work, but think about this. When you have the two coders that had two different opinions on something and they both felt pretty firmly about, and everything. Well, it's one thing for you to be able to explain, well, this is why we do this. Well, prove it to me, right?
Mhm.
Okay, I'm going to go out here and pull what it states, and then you can authenticate what you're saying. It's just not because you said so. I mean, that works with children. Can I go do this? No. Why? Because I
'Cause
said
I
so.
said that.
You know,
'Cause I'm your
that
mom.
doesn't work with providers, and it doesn't work with professionals. And that's another thing. Your providers. It's one
Mhm.
thing for you to tell them.
They always want it in
Right.
writing.
Yeah. Say,
Yep.
okay, here it is, and I've
Mhm.
highlighted this for you, and here's the website. And they're going to look at this and say, no, okay, I don't want to go there. But, or maybe they want to, maybe they would like more information. But
Now, another
you.
thing to keep in mind is when I was doing that mental health contracting, they were like, "But we're not Medicare providers." Yeah,
Mhm.
but you take TRICARE and you
Yeah.
take Blue Cross Blue Shield Federal, and any
Mhm.
federal agency is going to follow similar rules. You still,
Mhm.
because you accept federal money, doesn't mean you don't accept Medicare. Because you
Mhm.
accept federal money, you're under some of these same federal laws of abuse, waste, fraud. So if
That's
you're
right.
curious if at all what you're doing, if you're doing it to a federal entity, a medical assistance plan, that's federal money. It may come from your state. Half of it comes from the federal government. The other
Yep.
half comes from your state.
And now
So
that you have federal with risk adjustment and everything, HHS, that the federal aspect has their fingers in all aspects of insurance now. So you better, I mean, it's not the same thing, but it's still, you should be on top of it, is what I'm trying to articulate very
Yeah.
poorly.
CMS has, as much as people talk about Medicare and the government, they really are the best run facility. Only 4% of their money goes to overhead, where most commercial insurance carriers is at least 30, 40, 50% is overhead expenses. So Medicare really does have it together. Their website is just phenomenal. Especially your local MAC carrier is going to be just as good. So your local MAC carriers, you can find all of your coverage determinations. You can find, so in my field, in orthopedics, if somebody is in a nursing home for a hip replacement, right? They're at a rehab center, right? We can't bill our x-rays. We can only bill a portion of our x-rays because technically they're covered under the rehabilitation, which is Medicare Part A. So we get a lot of rejections, a lot that they're taking our money back with interest because we billed it all as one charge to Medicare. Well, you can go on your MAC carrier's website and pull up that information as to if they are in a nursing home and when the last time was they are in a nursing home, when the last time was they had a DEXA scan, when the last time, if they're covered under a work comp insurance, if for what diagnosis are they covered under work comp insurance. There's so much information on the Medicare websites. Your fee schedules, your anything you want to know. If you want to know if you can bill something bilaterally, that was a question I saw the other day on one of the AAPC forums, was 64418, can I bill it bilaterally? All you got to do is pull up the fee schedule and it will tell you if you can bill that bilaterally. Right on the fee schedule. So I wish everybody was just like Medicare.
It's easy.
They really do
when you
make
go
it very, very easy. If you want to know when the last time was they had their wellness exam, what criteria do they need for a wellness exam for their flu vaccine? They have all 21 screenings right on there. All you gotta do is click on the little button and it tells you every diagnosis, every CPT code, HCPCS code, what are you going to bill, how often they can have it, who can do it. I'm sorry, I'll keep talking.
I know. I mean, but this is exactly the stuff that most people don't realize, right? Those resources that are out there to you that will make your life so much easier. I was just going to say that when you look at the CMS website, it looks like it's not user friendly. It's a little intimidating. They're not hip per se, like, and flashy and everything, but everything is really straightforward. And if you know the right keyword to find what you're looking for, and that's where we go back to what we said, the site, put in site:/cms.gov, and then what you want to look at.
I
SNF,
do it
SNF,
all the time. All the time.
fee schedule, the whatever it is, and then that's going to get you where you need to go here, and then you don't have to worry and look at this and think, oh, okay, well, if I put in the word here and then it gives me all of this stuff at the bottom that's like, I'm not sure, and that'll get you right to where you want to go, and it will only search cms.gov. But the more you're in there and navigating it, the easier it is to use. And billers I would say they use cms.gov more. However, coders do too, because we have to know the right way to code it. I guess it isn't better. It's not one or the other, billers or coders. We both do.
The biggest, what's our biggest hurdle in E&M? 95 or 97, how to level. Books upon workbooks on the CMS website, about 95 examples spelled out. You can't get any more clear than
95 examples. Do you think that'll give it to me, or should I put CMS? No. What am I thinking? We should do a CMS.
Go to your site.
Yeah. Okay, so let's
try
see if
it.
I can just get Google to come up. You guys, I'm sorry, but my internet isn't the best. So we're gonna go to Google. You notice now all the things that I look at frequently, right? It's pretty bad when Amazon's before your income are in the list. Okay, so I'm
No,
gonna put in
Amazon is a
site.
little. Amazon is a favorite online. I don't even have to. Just,
I know, it's like that's what it is. Oh, I did it wrong. How did I do that? Did you see what I did?
I
Talk about
no.
dyslexia. I don't know how my
I think
children
it's
have
just
dyslexia.
slow. So yeah.
Okay, hold on. CMS.gov. Okay, now
Gonna do. Yeah.
we're gonna do your space, and then what were we looking up again? What'd you say?
95 guidelines.
95, 2 words. I got to be able to spell guidelines. That's
Yeah.
we have another whole discussion today. I was talking about. Wait, how do I? Curriculum is a word I can't spell. That's not a good thing. Okay, here we go. So look, I've already been in there.
You've already been there. Yeah.
Yeah, I was there the other day. And so I'm going to go ahead and click on that. We'll just see if how quickly it'll do it. I'm going to go ahead and get rid of these two, and that should save some space. Boyd's probably, his knees are shaking in the background going, "You're driving. What do you mean you're looking stuff up?
I know,
We don't
right?
want your internet to crash."
Right?
We only have
See,
10
he was
minutes
thinking
left.
it.
It's not going to come up in that time.
Why are you
Right here.
discussing this
This
stuff?
booklet. If you want anything if any provider, look, this is a 90-page booklet. If you have any provider
So we're going to
questioning
F.
any E&M service, bookmark this because this is, it tells you anything you need to know about E&M. And a lot of people are, okay, for the next year, you can use this information. And the next year, yay, we're getting new information. But yeah, even all, okay, how do you know what a context is? You remember what modifying factors are, all of that type of stuff.
And look, here's an
Yeah.
example. So
Yeah, and if you
in
look
this
at
example,
look at her side of her computer there where it says open an Acrobat, you see all those little
this
yellow
right here
dashes? Those are every
tells
single
you where
place that's got the word example. So it goes throughout the entire book, you can see. But yeah, so
oh, here you go. One
one
system, the
system,
ear is reviewed. Earache.
yeah. So your review symptoms positive, so extended. So I mean, if somebody's questioning why isn't my medical decision making higher, well, here's all your medical decision making tables. Here,
Mhm.
they have all of the information you're going to want.
And you can copy and paste off the stuff. So
Mhm.
you can, grab I'm not going to do it with here. Let me see if I can find a paragraph. Okay, so say I want this paragraph right here. You have the ability to grab this, go put it in a document, and cite where you've got it and say, this is straight from CMS.gov, 90-page document. So I pulled out this pertinent or this example, this scenario, straight from them. So that should make your life easier too, is to be able to do this. I've done this where I've gone in and say I want to do a teaching moment on something specific. I've gone into this very document, pulled a couple things out, put them in to the into another document slide deck, and said, there we go. My teaching moment. They described it better than I could.
But
Parenthetical examples. Okay, so we can get out of this and
so since I learned swing bed, Whitney says we have to do a webinar on it now.
on swing bed. Oh, that's another point for us as we're getting close to the end of the hour. We only have 6 minutes left. I wanted to let you know that we're going to kind of start something new this year. Our club members truly are, they're our hierarchy, right? We really are devoted to them. If you have a topic request, something that you would like for us to talk about, like swing beds or, billing, I mean, I think there's there's tons of coding resources. I don't think there's as many really quality billing resource education out there as some of the others, in my opinion. I don't think, maybe I don't search them well enough because I'm too lazy. I just asked Jennifer. But
Jennifer, here's one for you. I get this message.
I do that. It's like, here's a question for you, Jennifer. I just saw the word billing and no. So let us know if there's something. And if you're a club member, we will take that topic request and we'll get it in right away. I know Whitney, who's usually on a lot of our webinars, she did that the other day. She said, I want to know more about sleep studies and coding for sleep apnea and stuff. And I thought, oh my word, yeah, you're right. I've seen that question come through quite a bit. So bam, that was the very next one we did. The very next day we did that topic. And so again, feel free to let us know, all of our wonderful club members. We appreciate you so much. This is the resources. Of course, I used Find a Code. There's those 2 YouTube videos, and you can go to our medical coding cert on YouTube. We do go in there, we look, for the most part, that's not the platform we use to discuss things. The more you talk on those platforms, YouTube especially, it does raise us in some cosmic YouTube ranking thing, but we're not out there to be YouTubers. Yeah. Would it be wonderful if we had 1 million subscribers? Sure. I think you get a little plaque from YouTube. I was watching somebody say, like, yeah, I got 1 million. That's not what we're doing this for. We do YouTube to pump out free content for you, because it's an easily accessible platform to do that. And then, quite honestly, our thought process is that if we give you this free and it's valuable to you, then you'll come and ask us for more and come to us for other times you have questions about specific things. Now, CCO Live, that is a casual way for us to pump out information and answer questions for you, and for it to be back and forth. We monitor what you're asking, and that's another way we get off the topic very easily. You know what? In college, they loved me being their lecturer because they knew they just had to say something I was interested in, and boom, squirrel, I'm off in another tangent. Anyway, so we definitely want to make sure that you know that we're here to do that. Plus, a lot of people find us on YouTube because it's an easy search platform, right? LinkedIn as well. Professionals, you know what? We're here. We do professional consult type answering of questions. We're not a consulting company. We do education, although it falls into that, right? So we're not going to come out and do big consultations for your company. We might do individual stuff, but our job is to help you find the resources so that you can in turn go do that. Our focus is education, so we want to educate you to do that, and we have fun doing it because Jennifer and I really like what we do. Boyd really likes what he does, and part of his job, because Boyd is a separate entity, if you guys don't know that, by the way, from CCO. He just also works with CCO, right, Boyd? I mean, you have your own company. So by the way,
and we're getting shirts.
That reminds me.
Don't forget about our shirts.
We're getting shirts.
Soon we'll be.
Jesus is getting us shirts.
Yeah.
That's right.
I think you're gonna have to change your
background,
background, Alicia.
Well, yeah, he said
because you're going to be ahead in
black
chair and a black
I got a little lacy shawl I'll put on. Yeah.
We're also working on a podcast too, as well. So because you guys voted so positively in our last Q&A webinar in January, we have.
And if you want Alicia to just talk, then she can do a podcast.
It's like, what do you mean? I could podcast for a living? I mean, no, you don't get paid, but well, I guess you kind of do. But and another thing. Well, let me finish telling you what Boyd does. First of all, I have to let you know Boyd has 13 screens. I really think he should have 14 because 13 supposedly is a
but 13 number, was the tablet that's behind him. So
that's
got
10.
Tablet, then he's only 12.
That was number 10.
11.
So Boyd does this for a living. 12. He organizes and does all this. And so like when we do remote presentations or we're going to interview somebody, he meets with that he converses or whatever with that person, makes sure that they're set up so we can give you a professional presentation, because even Jennifer was telling us, oh, she said, oh, Boyd, I wish you were helping with this particular thing because you can't hear him on the mic and blah, blah, blah. So reach out to Boyd if you need that service. Little plug, Boyd. And the other thing is we want to do more interviews too. I enjoy that a lot, and that would be really good with the podcast. So if there's somebody that you'd like to hear from in our industry, in the medical business industry, healthcare, let us know and we'll try to get them on. I've got some people lined up that are outside the box, so I hope we'll have fun, and we'll do them in like the CCO live format, more casual and everything. So let us know what you want and we'll pump it out for you. Is it time to go, Boyd?
It is. Can you hear the music playing in the background? That's our cue music.
Oh, we have music now?
Yeah,
All
we do.
right.
He always puts it on the beginning. Yeah, we're too busy talking to each other in the beginning. We
Never
don't pay
heard it.
attention to the other stuff he does. Oh, bye guys. Boyd, you take us out,
All right. No, we're good. See
or
you
I'll get on
guys.
another tangent and tell you about
Yeah,
that other
exactly.
squirrel.
Exactly. Thanks, guys, for coming.